Hi, and welcome to Bob's Tribulations. And what I'm going to do here is try to present to you my experiences going through these zygomatic implants. There's not much out there on the internet, which you've probably found out. That's why you're watching mine. Most all the info is by the vendor or a doctor or a dental smiles outfit or whatever you want to call it. But again, very little from the patient's aspect. It's going to be quite an amateurish but long, lengthy video because this is a long, lengthy process, a very expensive process, which I'll touch on towards the end. But I'm going to start this off with my visit to the oral surgeon after I was told by my ENT and my primary physician that I had an obstruction from my denture going up into my nasal passages. So why don't we get started with my journey? Okay.
Well, here we are, March 2nd, 2021, and I'm visiting the oral surgeon who's going to take a look at my issue here real quickly as I'm sitting in the chair doing the social distancing, if that's what you want to call it, inside of the office here. But anyway, I'm going to have a 3D scan taken here in just a couple of minutes, and I'll be right back with some results. Well, the doctor just came in and put this picture of my 3D scan on a monitor that's in the patient room here, and as you can see, there is no bone tissue at all on my upper jaw. It is almost like completely gone, and my lower jaw, you can see too, there's hardly any bone where those original molars were. The only bone there is where my remaining front teeth are. Other than that, I'm completely void of any type of bone. So right now the surgeon, he's looking at the scan on his large computer, and he's trying to see if I am a candidate for the zygomatics in the upper jaw. He says, obviously, if it does work, it will take 4 of them, the quads, which we assume would happen. The lower jaw, he doesn't see any issues there. He can put either 4 to 5 implants in there after my teeth are extracted, which would be required. After a considerable wait, the doctor came back in and he said that he can do the quads, which was the main concern. The lower jaw, that's not really a big issue, but that upper jaw with those 4 quad implants is going to be a necessary stay at a hospital because there's such a small area that the zygomatics have to be drilled into the zirconia bone that I'm going to have to be put under general anesthesia to prevent any type of involuntary movement on my part. And also it's going to be about a 3-hour surgery to do the top zygomatics and also the extractions and the 5 implants is what he's come up with for the lower. So the next step is to visit the prosthodontist, which he's made arrangements for tomorrow morning. He wants to get me in right away on that. So until tomorrow. It's a beautiful March 3rd morning here at the prosthodontist. I've been scanned again, if that's what you want to call it. They're doing a they call it like a makeup of me. There's been people in and out and in and out, and I've had my mouth open, mouth jerked on, yanked on, you name it. They've pretty much established that I am a good candidate for the zygomatics and also my lowers, which is pretty much a full mouth reconstruction. So what they're doing right now is, it's actually pretty interesting. They took out my denture, and since it fit fairly well around my existing tissue and palate, they're taking a 3D scan of it, and they're going to use that scan for the first mock-up of a drill guide. That drill guide is to be placed in my mouth during the actual surgery, which will show where the zygomatic implants will be installed and at which angle that they're installed, which will eventually be connected to the upper prosthetic device. And as you can see here, there's some pictures of the actual zygomatics, one going in a particular position of the jaw towards the rear, let's say, the rear mounts, and another set that'll kind of crisscross going towards the front of the mouth. So there'll be actually 4 screw down points for that upper prosthetic. So now I've been just told that I'll have to come back on March 16th to take a first fit of that particular drill guide. So I'll get back to you on the 16th. I'm at my March 16th visit at the prosthodontist, and I'm going to be fitted with my first temporary of my uppers, and also I will be fitted for the first fit of my drill guides that will eventually make it over to the oral surgeon's office for his approval, with the mock-up of my jaw, which he did off the 3D scan. And basically it's a 3D printer of my my jaw, and he'll use that to make sure that it fits, and also to make sure that it's going to be installed correctly within the zirconia structure of my jaw. The first fit of the temporary really didn't go that well. It was actually too short on the front on my teeth, so they put a wax buildup on it, and you can see from this picture that it extended the teeth. Because of my lip structure and so on, I've never really shown a lot of teeth, and I don't want something that'll shock me or family, friends, and so on. But this is where I'm at, and my next appointment will be March 30th, I believe, and that's for the second fitting of the temporary. And if that fits, then it looks like we may be scheduling my surgery. So until then, I'll be back and speak to you then.
Well, good afternoon. It's Tuesday, March 30th. As I promised, I was going to add something here on this blog on my trip to the prosthodontist, basically to have my temporary fitted. Unfortunately, we ran into a few snags, and what I'm going to do is show you uh, pretty much what happened this morning. So let's head right on over there right now, okay? Well, here I am once more in the chair, getting ready as they pull out the temps and also the drill guide out of their containers. Believe it or not, they're sitting in water or some kind of solution. I don't understand why. But anyway, they're about ready to insert it in my mouth, and we'll see what happens here. Here we have the prosthodontist. He's inserting the second version of my top temporary, and it actually fits rather well. It conforms to the tissue at the roof of my mouth or my palate, and also what little gum line that I have. So again, surprisingly, it's really a very good fit. Here's my first look of version number 2 of my top prosthetic, and as you can see, it looks like I may have some teeth beginning here, but the doctors, they're not satisfied with it because they're saying that because with the shape of my top lip, it doesn't really conform to it. So what they're going to end up doing is taking those molars and pretty much taking them down in size, and my front teeth, they're actually going to bring down 2 millimeters. So anyway, the look should be a little bit different on version number 3. Now this is probably the toughest decision so far, and that is what color do I want my final teeth to be. I don't want it pearly white like a Hollywood Elite, and I sure don't want that stained yellow look that I pretty much destroyed my teeth with tobacco use for the last 50 years. So we chose something a little bit kind of in between, and since I'm fair skinned, they picked this. I can't recall the number of it, but it's white, but it's not a bright white. And if you can see closely with my bottom teeth, there is quite a difference. No, that blue stuff in between the teeth is actually a temporary kind of a filler or adhesive that they use just for this particular fitment. Here we're getting the light standards set up around my head, and they're going to take some photographs here real quick, and what they end up doing is sending these photos back to the lab technician that's making the prosthetics, and it explains a little bit better what the doctors are attempting in particular changes from version 2 to version 3. And it's kind of a pictorial, let's say, of what they're doing. Normally, they don't show these to the patient, but I did get to take a quick peek of what they actually do. This is probably one of the most interesting aspects
of this procedure is that the oral surgeon had this 3D uh, skull, let's say, made up of me, and he uses this for the surgery process. And of course, the prosthodontist, they borrow it from him basically when it's completed, and it helps him also in the fitment of the prosthetics that will be eventually put in to my mouth. And what the surgeon will do is use this uh, basically as a practice guide. He'll take the actual drill guide, which you'll see here in a few seconds, and he places this on that uh, that jaw area, the upper jaw area, and that will direct where the zygomatics will go into the zirconia bone and where they'll basically crisscross. So they actually practice this with this 3D printout, and to make sure they have the process correct during the surgery. And from what I understand in my previous research, some doctors do not do this, but my ENT, he highly recommended, and actually he insisted, that I find an oral surgeon that goes through this process. Yes, it costs more money, but it really reduces the amount of risk of the zygomatics penetrating into your sinus cavities. Here we have just another view of the upper jaw, and it pretty much shows what little bone that I have. Uh, in fact, the surgeon tells me that I am the absolute worst case that he's ever seen. So it's going to be, you know, quite the accomplishment, as he jokingly said, if he could make this work. But another reason why he made this 3D mock-up of my jaw area to make sure that those zygomatics are installed in the correct position. I finally got my first look at the actual drill guide, but unfortunately, I couldn't take it out of this bag. It's wrapped in like a some sort of a like a gelatin, and they use that to preserve the actual material, and it won't be removed from this bag since the surgeon used it on his practice routine. And next step would be in the surgical procedure.
Well, it's been a long day, and hopefully, the third time is a charm as far as this upper prosthetic and getting it correct. I have an appointment for next Wednesday, April 7th, and hopefully things will work out there so then I can get my surgery scheduled. So until then, we'll talk soon. Well, here we are once again. It's Wednesday evening, April 7th. I spent a couple hours at the prosthodontist this morning, meeting with him and also the oral surgeon. The final fitment of my temporary, again, did not go that well. It's still somewhat loose, so they're going to send that back to the lab. But what they spent most of the time on is actual fitting of that drill guide. And once they had the guide in place, temporarily glued in, they took a 3D scan again of my skull and making sure that those zygomatics, the four of them, will be inserted into the zirconia bone at the correct position, making sure that they don't enter into my nasal cavity. So that's pretty much it to report on, other than Unfortunately, I didn't get my surgery date. They say they have to wait until that final makeup of the drill guide is in place. And we're going to test it hopefully one last time next Wednesday, April 14th. So that's where we are. And we'll see you next week.
Well, here I am again. A few days late because my other appointment was canceled out on me last week. So it's now on the 19th of April, and the temp seemed to fit okay. Of course, it's just the third trial. They said I could have up to 8 attempts by the time my permanents are actually made. But I'm a little pissed off kind of at the doctors because we had tentatively set the schedule to have my surgery done in June. And now, because one of the doctors is going to be on vacation that particular week, it set the whole thing back a month. So, the good and the bad, I do have a surgery date scheduled. That would be for July 14th. And again, the bad side is I have to wait now a couple of months. I'm all done with the fitting of the drill guide and also the temp. So I guess there's not going to be anything happening until probably the week before the surgery when I have my pre-admittance physical to make sure I guess I don't croak on the table. So it'll be a while until I get back to you. Hope you have a great day. Fly safe. Well, here I am. It's June 29th. Yesterday I had my physical for my upcoming surgery on July 14th, and everything went according to Hoyle. Did my chest x-ray, COVID test, all kinds of different, the usual physical things. So I'm happy to say that everything is a go at this point. Apprehensive? Boy, I sure am. Scared? Yep. I've done some crazy things in my lifetime, but this is really kind of quite different for me. Anyway, I guess I'll see you the morning of the 14th when I'm on my way to the hospital. Have a great day.
Well, here I am. I'm back. I made it through it. This is day 20 post-surgery. Excuse me for not having a voice because obviously they pulled all my lower teeth and the upper teeth, there's nothing there, which I'll explain here in just a little bit. It was a much larger ordeal than what I was expecting, but I do remember the two oral surgeons discussing with me and telling me that these were going to be the actual problems and possible side effects and issues that may become of the zirconia implants. So yes, it didn't go all as well as what I expected. There was one of the Zygomatic that did not seat correctly. Not so much of the fault of the doctors and so on, but it's just that my lack of bone tissue, they were unable to actually torque it down. And it just affects me for the next weeks, or even could be months, but the actual end date when I get my terms shouldn't be changed at all. So anyway, let's go back to the surgery date, and I'll try to explain to you a little bit further on where we stand at today. Okay, so let's go there. Here it is, the big day, July 14th, 2021. I'm sitting here in the surgery center, 9:30 in the morning, waiting for my pre-op procedure to start. Again, I have to apologize because I'm doing this post-surgery, and obviously I'm missing teeth and everything else. Things just aren't working well, so just have to excuse my voice here. Well, that's about as much as I could say. Going back and looking at this particular photograph, it was taken with me when they put me in the car after the 6.5 hour surgery time. It was getting late in the evening, almost 9:30 at night, so I had the feeling they were kind of rushing me out the door. But as you can see, looks like somebody beat the hell out of me with a shovel. I did experience an awful lot of pain at that time. I was pretty much numbed out with pain meds, plus my face was completely numb. I think what hurt the most was my left nostril, where you can see that's where they had the intubation tube going down into my lungs to basically breathe for me during that time. So your nasal passage there, it does take a beating. Obviously, they can't put the tube down your mouth when they're working. And so that's what hurt the most. And I'm on my way back home, and my wife will meet me at the door, and because of COVID issues, she could not be at the hospital with me. So let's move on to my next pick. On day number 2, the 15th of July, I went back to the oral surgeon, and where he wanted to do a CT scan and also checked incision points, stitches, and so on and so on. I was still pretty much out of it because of the painkillers that they gave me, which was actually quite strong. So nothing to report from me on that particular day, but I do want to point out here with the CT scan, the frontal version of it, and as you can see, the bottom teeth, which were extracted, and then I've had 5 normal implants put into their place, and absolutely no problem with those at all. In fact, they'll set good, and they're ready to load if there was what they call it. Otherwise, they can put the temp in. Now, on the uppers, you'll see the 4 zygomatics, and 2 of them obviously on each side, extending. They actually go in and drill right behind your top lip, using that drill guide that they made for me a couple months back. And that drill guide will direct the drill up and in next to your eye socket, but avoiding your nasal cavity. And then, of course, once you're done with that, they'll go in and suture up around where the end of those zygomatics protrude down through your palate. 2 are right behind your upper lip, and then 2 probably about an inch further on your palate, back towards your throat. Here's the CT scan of the right side of my face, and these two zygomatics went in absolutely perfectly. No issues to date, and everything's set very well. Here's the left side CT, and you can see the two upper zygomatics installed. And it was one of these zygomatics that, because of the loss of bone tissue, they couldn't quite tighten it up. So because of that, as you can see where that zygomatic comes down into the mouth, there's actually basically like a socket, and that you put the temp on, the screw goes into the temp, into the zygomatic right there, and again, it's called loading. And but because of that, the pressure that you use on chewing and so on, all that force is not going onto your gums like a normal denture would do. Instead, that force is being put on those zygomatics and those other implants. And so when you have a loose implant, it's going to fail on you. So the only thing that the oral surgeons told me they could do at this point is to just bide my time, and the natural bone growth, the body, let's say, will actually tighten this one particular zygomatic down. And but that's going to take close to 6 months to do. So obviously, that is going to change our plans as far as me getting a temp right away. In fact, that's why I didn't have the temp installed the day of or the day after my surgery, because of this one zygomatic. Well, here I am on day number 4. I'm starting to come around mentally, but my face looks like it still took a pretty good hit, but it's actually better than what it was the day before. The last couple of days I've been on hydrocodone, and they removed me from that, and so I'm starting to think squarely. But as you can see, my eyes are swollen, my face is swollen, eyes are starting to get black. I have no feeling at all in my face, so I'm drooling out the corners of my mouth, finding it quite difficult to eat anything, baby foods or any type of soft foods, and I have to use a special syringe that they gave me to give my proper amount of water intake that I'm watching daily, so I don't get any type of issues with the dehydration. Day number 5, with a lot of icing, which I've been doing from the get-go, it really removes a lot of the swelling in the face. I'm getting some of the feeling back on the sides of my face. Lips are still numb. Chin is still numb. But I've noticed, it's kind of strange, but you'll see that the swelling has kind of like moved down into my neck. So I have a lot of loose skin there anyway from a previous weight loss program that I went through a few years back. It just never went away. So it just seemed like all the fluids kind of collected there. And as you can see, it's rather big, but I'm actually feeling pretty good at this point. Day number 6, I'm really feeling a lot better. Again, the discoloration around my eyes is getting a little bit more prevalent. I'm starting to feel my face a little bit more, although, again, my lips are still completely numb, which is causing drooling and so on. And the thing I'm happy about too is that a lot of that swelling has gone down in my neck, especially. But I have been doing what the doctors have told me with the icing and warm packs and so on. So I feel pretty good. Tomorrow I go in to see the um, oral surgeon again. He's just going to check up on things. So I made it here to the oral surgeon's office. Actually, I have two surgeons that are going to be checking up on me this morning. And so far, after a quick exam and again getting ready to go get some more x-rays and CT scans to make sure everything is going well, but actually I feel good. The studs hardware now in my mouth, I'm having an issue with rubbing on my tongue, let's say. And as I try to speak, which I shouldn't be, they told me not to. But at the end of all of these implants and the, let's say, the threaded inserts on the end of the zygomatics, they put in it's like an acrylic screw, and it's a round-headed screw, and that's supposed to prevent any irritation on your tongue and so on. So that's kind of where we're at. So that's good news so far. He did go back and explain to me what the issues were with the zygomatic that would not tighten, and how it's going to take future bone growth to tighten that up before I can put any kind of load or a temp, on those zygomatics. Well, day number 10, I'm finally back here at the prosthodontics office, and he has been in contact with the two oral surgeons almost on a daily basis. And he was actually quite disappointed that they couldn't get the proper amount of torque pressure down on that one zygomatic. And because of that, obviously, like I previously said, they could not install the temps. So right now, it's a decision that I kind of have to make. And the oral surgeon said that, or recommended that I just stay away from a temp right now. Let's wait for about 3 weeks, and let's see how I'm feeling and how the tissue's healing and so on inside on those zygomatics. And we just don't want to rush things, as he says. And also the propho guy said, yes, he could insert the lower temp, screw it in, or put a load on those temps. But he did not want to do that because he says those bottom new teeth of mine would just chew the hell out of the upper tissue where I have nothing. And except for those zygomatic fittings, let's say. And so he said it's too risky to damage that, so he's going to leave that out. And he's pretty much said the same thing as the oral surgeons. Let's just wait. There's no reason to rush this. And like I had mentioned before, as far as the end result, he says it's not going to affect that. We're still looking at 6 months away before we can get the perms. So again, I just have to make a decision. Do we want to go with the temp route, or do I just want to say the hell with it and just keep waiting a little bit longer for everything to heal and not take the chance of the temp bothering that one questionable zygomatic and possibly messing the whole thing up. So anyway, that's where I'm at.
Hey there, it's August 17th. It's my 35th day post-surgery. I'm here at the oral surgeon. I just met with him and one of the prosthodontists that came to the office for my particular case. I'm really kind of thrilled because all the problems that I thought I was probably having, maybe too much time on my hands, it's kind of funny. But you know, your imagination does start to play some tricks on you at times. So what happened this morning, he did a complete exam, did another CT scan. Everything looks good there. The pain issues that I'm having are absolutely pretty minor right now. Basically right up here by my temples where the end of the zygomatics meet, that's always center, which he says it's going to be. Also, I have some pain under my upper lip on the tissues, and again, that wasn't because of being cut on. All in all, he said this, you know, the tissue pain, it'll heal. It's all part of the process. I thought it was because he actually drilled right through here, which wasn't. He drilled back about, probably about a half to 3/4 of an inch for that forward rod. He says what happens is my mouth gets stretched, you know, large enough to put a football in it, and so there's a lot of tearing and things like that, and it all depends on you know, the individual involved. That's why some of these people, he said, can go into these places, you know, that advertise the one-day surgeries, and everything works out absolutely fine. But what they never tell you about is the people like me that have really a severe case of bone loss, and it's a very, very involved surgical process to put these four zygomatics in there where there's no bone really to hold it. But I have just one out of the three that didn't quite firm up, and so that was really the largest part of our discussion today was, well, where do I go from here? What do I do, since we can't load or put any pressure on those zygomatics until that that fourth quad is actually secure in the bone, and which takes 6 months, which we talked about earlier. So what we decided to do is I'm going to play it safe. Hey, I'm 70 years old. I got, you know, more time, hopefully, and so I pretty much decided not to go with the temporary denture route to put on there, because what happens is it puts excess strain on the actual tissue, so it slows down the healing process because they can't load the temporary on, which again we previously discussed, and that temporary doesn't touch the tissue that's loaded. A temporary denture does, and also they have to make these relief cuts, basically holes in these dentures, so it doesn't touch any of the actual implants and put unnecessary pressure on them. But there's all kinds of issues as far as food getting stuck in there, and then putting pressure on it that way. Um, there's other issues involved, such as after they did this, it actually changed my palate. So that temporary work that we put in to make these temporary dentures back a few months ago is pretty much all for naught. It's just because during the surgical process, they had to change some of these issues around to get these zygomatics to fit. So, what they're going to do, starting the end of this month, the prosthodontist is going to start making a, basically getting ready to put the first set of temps in, loaded up, which is going to be in, well, 5 more months. 5 more months of putting up with this crap, and no teeth. I look like crap, but hey, that's okay. That's what we got. That's what we got these stupid ass masks for now, right? Yeah, so it's a good excuse. So, other than my talking, I'm feeling pretty good. I can't eat much of anything. Hot and colds don't bother me though anymore, which is good. So I can have my coffee, and I'm just going to have to keep increasing the nutrition type of drinks, and use my syringe that I have to get the food down me, let's say, which works really well. So anyway, that's where I'm at. I'm actually kind of happy, and so I have my prosthodontist appointment, like I said, the end of this month, and I'll get back with you and around that time. Okay. Have a nice day. Here it is, Friday morning. I just got back from the prosthodontist's office, and everything is going well as far as the healing of the tissues, and also the 3 out of those 4 zygomatics are really solid. It's that 4th one that's giving me the issue. But from the last visit with the oral surgeon, we've all come to the conclusion that we just have to wait. I figure I've got to wait this time out while that bone grafting takes place in that 4th zygomatic, and then at that time we can go ahead and load it. But in the meantime, after probably in November, we're going to start working on that original, let's say the temporary, because we have to kind of go back and redo the entire thing because of the necessary surgery that had to be done around my palate, which changed the ridge, which actually there is no ridge there to hold a temporary denture other than glue, which is my decision. I don't want to do that. I've dealt with too much glue in my life, and so that's kind of where we stand right now. So it's going to probably be quite a while here until November, until I speak to you again. So everybody stay safe and fly safe.
Hey everybody, want to get back to you. It's been a while. Today is December 14th, day 152 post-surgery. And as you can see, I'm kind of like, you can't really, most of my inside my mouth and everything has shrunk up and done what it pretty much was going to do. This is one of the reasons why they only put a temporary in, because it's going to shrink underneath that temporary, and eventually they're going to have to keep redoing that temporary until it gets down to almost that 6-month period. where things stop doing this and gets back to its permanent state. And then they go ahead and make the expensive part, and that's the the perm, the zirconia permanent. So right now, as I said, this is the 5th month, so I'm kind of kind of perplexed here as far as, do I go ahead and start making the temp and so on. They said we can do that, but I decided, no, I don't think I'm going to do that. I'm going to go ahead and just wait 6 months. Sometimes in my particular business, you don't want to do business over the holidays because you're going to get, let's just call it questionable work, right? We'll just leave it as that. So I decided, again, to wait until my 6 months is up, which would be January 14th. And because of that, I have appointments set with the prosthodontist beginning in right around mid-January. And what they're going to do is start making that temp, since the old one will not work. The one they made several months ago, it ended up in the trash can. So here I am, unable to eat still. I shouldn't say that. I've been eating baby food and everything else. And like I said, I've had this little handy syringe here. I actually use this for oil and so on. And no, this is a new one just for me. That's completely dishwasher safe. And it holds about 12, 14 ounces. And but it's great. Hey, squeeze it in, whatever it takes, I'm not proud. And also, I went over there in my toolbox and I grabbed my endoscope and stuck the thing up in my mouth, just to give you guys a picture here of exactly what they did to the lower implants and also those 4 zygomatics, and actually what they look like. You'll see that they look like white, but those little white things here, what they really are is they're safety caps. They go down to the gum level, and they stick up. They just screw on with a wrench, and it's to keep those really fine titanium threads, from getting gunked up with whatever. So anyway, that's where I'm at. And so I guess, we'll see you after the new year, and hope you have a fantastic 2022. Okay. Later. Hi, everybody. Hope everybody had a good year. It's been since December since I've posted anything on this blog. I just wanted to bring you up to date. On February 20th, I had my visit to the prosthodontist, where they went in and made the impressions for my lower arch and also my upper arch. But before they could do that, they had to take a wrench and unscrew these safety caps that we had talked about before on the bottom arch, and then of course the 4 zygomatics up into my palate. So you got to excuse my drooling. I've been putting up with this for 6 months, but hopefully we're getting towards the end here. But I just want to show you a picture here real quick. This is of my mouth, let's say, on the lower arch where they insert these titanium pins, and they're going to put a cup, let's say, over those pins and down onto my arch way, and then they actually fill that with a compound, and they let it sit for about 5-6 minutes, and then they have to pull this whole thing out. But when they do so, they actually pull these pins and everything out at the same time, so that leaves a real accurate representation of that arch. And then, of course, when that's done, they do the exact same thing on the upper arch, but putting those pins on the 4 zygos and just hoping that I don't bite down on that point and put those things through my tongue. But it was probably about a 45-minute to an hour process. And they cleaned me up and they said, okay, you're going to come back here on February 10th, and where they're going to have an actual temporary white wax impression. That's actually a very hard wax, and they're going to make sure that both temps fit, top and bottom. And then after that, they will go ahead and make the first set of acrylic temps, the throwaway temps, let's say. And so how many sets of those we're going to go through, I don't know. I don't have a clue at this point, and they don't either. But they said they won't make the final set of temps until I am absolutely satisfied with the way it looks, the colors and things like that. Then they're going to go ahead and insert that temp, and it probably won't be until March. And then I do the waiting process at my convenience. And when I feel that the temp is great, I don't have any problems, then they'll go forward with making the finals in zirconia. And so anyway, I'll get back to you after the 10th of this month. All right? Later. Hi, everybody. It's around day 220 post-surgery. I went, about a week and a half ago, I went back to have my first wax built up in my mouth since I bided my time and waited, for this one bad zygomatic, not bad, I should say, the one that I had to graft into the bone. And, but it's been torqued down by the oral surgeon and so on. So everything's cool to proceed. So going back to the prosthodontist, they have a particular, it's a guide that, it makes sure that everything bolts up to that, to those zygomatics without any issues. And they were able to mount 3 of the screws, no problem at all. But it's that one problem child, zygo, where it changed the position just a hair, just enough so when they went to put the screw in, it would just keep turning. Otherwise, the Higby on the threads would not catch into the implant. And so there's no starting it. And of course, you don't want to try to cross thread it. So we had to stop right there. I came back last Thursday, and again with the, I should say the right size template, and they bolted all 4 of the screws in to zygos, and hey, felt great. It really did feel very comfortable. So they went ahead that same time. It was about a 2-hour time period that I was sitting in the chair, and they made the wax. It's kind of like a buildup on that plastic plate that they screwed on. And so what they do is they put that wax, and they want to make sure that it fits the arch correctly. And also what they want to do is to make sure that it's level. And so of course your teeth don't look, slanted one way or the other. So they have to work that in. And then lastly, once they have that configured, then they drop the wax down to where the bottom of your teeth would show. And they take various pictures of your lips being, grinning, smiling, and everything else. So they let this computer figure it out, and so they come up with these measurements. And so the first temporary, pretty much what I went through, God, almost a year ago, it seems like. But anyway, that hopefully will be ready to it'll show, the actual temporary teeth, the acrylics. And and if all fits well there, then they're going to go ahead and make the first temporary that they're going to load, and that's the one they're going to experiment with for time, as far as what it's going to look like, appearance, comfort, fit, bite, you name it, because it's got to be absolutely perfect before they make those zirconia finals, because they're about, hey, they're a lot of money. We'll get to that towards the end of this procedure. But anyway, that's kind of where I'm at. They wanted me to come in next week, but because of a work commitment, I'll be out of town for almost a month. So my next appointment, hopefully get this thing fitted, will be March 17th, St. Patrick's Day. So until then, we'll talk later. Fly safe. Hi, everybody. Well, it's been a long few weeks here. I went back on St. Patty's Day, March 17th, and I had another fitting. They put the so-called first set of teeth, the actual model of the teeth, let's say, and we found some problems. They weren't large enough, so we're going to go up one side on the teeth, the width, and also the length. Again, we brought it down before, but it still needs more, mainly because the structure of my lip is so screwed up here. And they call it heart shape, narrow and heart shape. And so it's really hard. And maybe that's one of the reasons I've always had a problem smiling and showing teeth to begin with. But anyway, so since that March 17th appointment, I've been back three times now. And every time they just keep redoing the teeth. It's just like little tiny tidbits of changes, but it's got to go back to the lab, and they got to do their thing, and then it comes back, and the prosthodontist has to okay it. And in the meantime, I had to go back to my oral surgeon, where he wanted to torque this bad zygo again. Just to make sure everything was okay. And so while he was at it, he went and put a little torque wrench on all of the implants, and everything was just perfect there. Very healthy tissue, no issues. So he's really happy with it. So that's kind of it. You can see here on these photos I'm putting up, it's kind of in the order that some of the changes has been happening. And some of the pictures you'll see some really weird positions. They wanted me to try to show the teeth in. That's why I look so damn funny with it. And but of course I'm going to go back again on the 20th of April, and then I go back again on, I think it's like the 27th of April, and so hopefully we're going to get these the acrylic temps made. Getting really anxious to get this done, but I gotta say I look so strange with teeth in my mouth, and it feels so bizarre. And I did have an issue, with speaking when they put these in, and they said that was going to be an issue, which I knew that again up front. what they also wanted to do is line up my top lip. Obviously, over all these months, everything shrunk up where they knew it was going to be. Another reason why they wanted to wait this time, so then they'll get a better fit with the temp, and actually a better job overall with the final zirconias. But you can see on one photo, you can see where my upper lip is inward, and what they were trying to do is bulk up that top arch piece, so my lips were absolutely together, let's say. And so once they got that setting, then they're going to go ahead, and this is what we're going to check again on my next visit. So that's, again, where I'm at. I don't know how many times you've heard me say that, but that's the truth. So we'll see you after maybe 2 more visits, and maybe we might have a reveal with the temps. I don't know. I really don't know. So anyway, until then, have a great day.
Well, here it is, the 22nd of April. I just had my the final fitting, and excuse me here, a little bit of noise, but I had my final fitting, and I'm all set to have the first temporary denture, not denture, but the bridges, the top and the bottom, installed next month on the 19th. So I'm hoping, that everything's gonna go okay with this one. Anyway, I'll throw a couple of pics up here to show you what the final mock-up look is going to be. And of course, that's not permanent. I can change that if I need to. So I'll talk to you again next month. Okay? Have a great day. Well, hi guys. Guess what? After all of this, 308 days since my surgery, I've finally got some temps in. All right. They're not exactly correct yet. The bottom on those implants did fine, but the zygos on the top, once they put everything in, we noticed that it went up a little bit ways. So what's going to happen, they're going to take this set of temps out, and they're going to put it on their 3D scanning computer or whatever it does, and they're going to actually extend the portion, not the teeth, but the actual upper side where it meets the zygotes. And they're going to extend it about 2 millimeters. Then that'll be sent back to the lab, and I'm going to come back to the protho. I believe it's May 31st, or I get my dates so screwed up. But anyway, it's either May 31st or June 1st. And so they're going to try that second fitting in. But right now, it feels really good. I finally ate something, and this morning I actually had bacon. Oh my God, it's to die for, because my stomach feels it now, because I haven't eaten any of these type of foods, for going on almost 11 months now. That's where we're at. So there's not much more to report, other than my next appointment, and get that second set in, and then hopefully we can move on from there, because I'm really tired of this. I want to be over this. I'm going to probably have to go to a speech therapist, though, they told me, to get rid of this lisp. And as you heard through all the videos, probably there's this smacking, and that's caused from my tongue, they say, hitting improperly up on the palate, where they basically had to do the work by the zygotes. That's just another side effect with zygotes that sometimes they don't tell you. But it's not a big thing. Actually, one of the oral surgeons told me, hey, just read a book and out loud. Forget the therapy, forget paying that kind of money for that. And read to your dog, do something. It just takes time. I did notice, though, that the holes that screw down for the zygotes, where it holds the hybrid up against the palate, they're kind of exposed on the temps. So you have kind of like an edge around those holes. So you have to expect that, because that's going to irritate your tongue. So you end up getting sores. And in my case, I went so long waiting for my bone grafts to heal that I got used to having my tongue flopping all over inside my mouth, if that makes any sense. So now my tongue is restricted between the teeth. Surprisingly, though, again, it's worked out really well. I mean, so far, I'm happy with it. So we'll wait here next week. I'll report back to you and see what the second attempts look like. Okay? Have a good day. Peace out.
Hey all. Well, I'm back here. Again, today is like day number, I believe it's 319, and post-surgery, and just doing a walk around the airport right now. Anyway, I've completed my second set of temps, and everything is going okay. We did decide to extend these two middle teeth here on the top arch. Probably about 1.5 millimeters. And with that being said, I'm pretty sure that we're going to be able to proceed with the finals. Finally, my God, it's been a long time. And just by chance, they scheduled me. They're going to be making the finals now. And we hope to have them installed on July 14th. And July 14th, just by chance, happens to be the anniversary date of my initial surgery. So, as all the docs told me to begin with, my God, they said, well, the process is going to take a year to complete. And sure enough, that's what we're looking at, a year, right spot on the money. So far, I'm very happy with the work. I still have somewhat of a lisp, and but that's caused by the air movement between the hybrids and your gum lines, and where the implants are actually installed. So from this point out, all I have to do is practice my speech. The finals will be made again by a 3D printer, and which will be an exact duplicate of these implants, the temps. So they should screw in, fairly easy. It only takes them probably maybe 15 minutes to unbolt me, let's say, and take everything out. No issues. You have to be careful though with the cleaning, for sure, with a water pick, and I've been faithful doing that every time I eat. And so far, when they've taken the temps back out, there's been no food or anything like that. Slight staining because of all the coffee that I drink. And but with the zirconia finals, they don't stain. I've been assured that. So anyway, I'll get back to you after the finals are installed, and maybe we can sum up this really long and horribly amorous video. Okay? Until then, July 14th.
Welcome back. Believe it or not, this is day 375. 10 days ago, I had my finals installed. Wow, 365 days. That was a 1 year process right to the day. You, you got to ask why. Well, there's several factors. Number one, I wore a top denture for 45 years, and that thing literally destroyed all my bone mass on the top of my jaw. So, of course, the denture wouldn't fit. I was having all kinds of issues, nose bleeding and so on, with the denture protruding up into my nasal cavity. Anyway, I was a complete mess. So I went around, checking up on all these different places, trying to get quotes and so on. And most of the doctors I went to, especially the clinics that specialize in this, they wouldn't touch me. They said, nah, it's just too involved for us. So checking around, I found a board certified surgeon that does this quite a bit to severe cases. And he took me on. And so after 1 year, I mean, I am absolutely thrilled with the results. Besides the lack of the bone tissue, we had that issue, like I previously explained, with the one zygo that wasn't seating correctly. So we had to wait all this time, over 6 months, for that thing to actually graft in. So when he put his little torque wrench up there, and hey, it's set, it clicked, and hooray, so now we can get going. Unfortunately, we didn't have all of those temps that we had made, because during the surgery, the arches actually changed shape. So the temps could not work. There's just no way without harming the implants. So anyway, so we had to make new temps again, and that took time. And then I was on vacation for 6 weeks, and so on and so on and so on. But now, hey, I'm back here, just happy as a lark. These things are just like, I mean, they are solid. I just love the zirconia. I'm glad I made that decision. It's a lot more money, but they're a lot harder. They're like glass, very sharp. You got to watch yourself at first, because you can, bite your tongue very easily with these things. But now, I mean, just in 10 days, I mean, I'm eating steak, chicken wings. I mean, these things are so strong, I can actually crack a chicken wing with it. I mean, I am just thoroughly elated, and actually, I've had a lot of compliments. If you look back at the beginning of this video, you can see where my teeth were, as you can notice here in this little blip. And so yeah, it's been a change. It's just been a great change. Took me a while to try to get my speech back. I'm still having some issues with it, but that's going to come back. All the numbness that I was scared of in my jaw and everything, that's all gone away. Feel everything. So it's again, I know people get sick of me saying this, but I just absolutely love that I went through this. The only thing that I really feel kind of bad about is why the hell didn't I do this 20 years ago, instead of taking all my money and buying toys and flying off to buy $100 hamburgers. And I mean, it's just ridiculous. So um, anyway, so I went ahead and spent the money. Now, the one thing you might be asking now, how much did it cost? Well, these are the figures. Uh, my hospital outpatient uh, was $4,036, and that just basically paid for the table that you're laying on, let's say, and the facility. Uh, you also had to have an anesthesiologist there, and because they put you under a general anesthetic with this much work, and so not just a happy shot, they literally got to put you under a general. So that was $2,400 right there. Now the oral surgeon, he charged, the second oral surgeon never charged me. He's kind of like his partner, and would come in and they would consult with each other. And but the oral surgeon for the four upper zygomatics, and the five lower standard implants, his total bill was $25,815. Now the prosthodontist, who's the person that really did most of the work, most of the appointments were with the protho, and all those temps, that was all contracted into the original price. So I wasn't charged anything beyond what the original contract price was. And with the zirconia material, it added a lot more to that price. So it was basically $18,000 for the upper and $18,000 for the bottoms. So we had a total of $36,000. And so that gave us a grand total, with a drum roll here, of $68,251. But it did not include my loss of time, wages, and so on from work, and travel expenses to and from the doctor's appointments and so on. But again, like I said, it's well worth it. And if you can afford to have this done, I would highly recommend it. So anyway, I won't keep you any longer. I've kept you enough. You've been great if you've stuck with me here for this long process. I know the video isn't very good, so but I don't do this for a living, so, as you can obviously tell. But I want to thank you for watching through, and if you have any questions and so on, just put them in the comments, and I'll definitely get back with you. Okay? Have a great day.